Yes, the floor is yours. Please, we hear you.
Thank you very much. Well, I will start with my presentation. Before that, let me thanks to the organizer organizing such beautiful and informative session and event. I will going to share with you actually our Turkey experience in reform which we made in healthcare industry. So with my presentation, I will go ahead. My name is Emin Çakmak. I'm the founding chairman of the Turkish Healthcare Travel Council. When we started our journey with healthcare travel, we started with healing generation for centuries. Next, please. So this is our member of profile. We have hospitals, clinics, travel agencies, hotels, and many other stakeholders with us. Next, please. This is our THTC network offices worldwide, 92 countries, under 68 offices, from New Zealand up to Canada. We are cover all the 5 continents. Next, please. So the healthcare reform in the country, which made by Turkish government, the Turkish government has made very successful healthcare reform in the country, opening the private hospital to the public health under social security insurance, land allocation for the investors, tax incentives, and equal right for the foreign investors as well in healthcare. Next, please. So investment in healthcare in Turkey, Republic of Turkey invested in last 90 years for human resources. Government and private sectors has been invested more than $50 billion, 50 billion US dollar in healthcare industry last 20 years. Turkish leading healthcare pioneer has started investing in other potential countries as well in terms of hospitals and clinics and healthcare services. Next, please. So the quality and accreditation also, it takes a very important role in healthcare reform. Since you built the high technology and the latest technology, latest state of art of machinery equipments, of course you need international accreditation and quality as well. So all hospitals are under quality and standards accreditation of Turkish Ministry of Health. Ministry of Health has established special directorate department to control all the rules and regulation and the price for medical tourism and medical healthcare. And of course, internationally, JCI accreditation is important to add on your reform that you can be recognized international accreditation and quality. And also our council are doing the accreditation for healthcare and medical tourism as well. Next slide, please. The incentive support by the government of healthcare tourism in Turkey. In the beginning, Turkish Ministry of Tourism has opened up all tourism fairs and healthcare sectors to promote their industry, to promote their hospitals and services. And since 2012, the Ministry of Economy and Trade has introduced new incentives support program for medical tourism. Why I'm talking about medical tourism? Because without medical tourism income for healthcare industry in Turkey, the reform cannot be completed and reform cannot be successful, because the income from foreign patients to Turkish healthcare industry was very important and was very essential and very sensitive, because the income by medical tourism annually up to $5-6 billion, $10 billion has contributed to develop the reforms of medical and healthcare industry in Turkey. Next slide, please. The Ministry of Trade, of course, has very good incentives for healthcare industry. They are supporting the exhibition reimbursement of 50-70%, and accreditation, international accreditation of healthcare industry, also supported by the incentive by the Ministry of Industry. So the flight tickets also has some 50% reduction and reimbursement up to $1,000, and market monitoring, promotion, Google, digital platform, advertisement in all channels actually. Next slide, please. So strong branding and marketing help a lot the reform in Turkey, because doing the strong branding and marketing and bringing a lot of contribution income has helped and support the reform of healthcare industry, building new hospitals, building new clinics, and having new technology. Next slide, please. So being a tourism destination also helped a lot the development of healthcare and the reform of healthcare in Turkey, because since you receive 50 million, close to 50 million tourists in a year, in 2019 we closed it like 42 million tourists coming to Turkey from 180 countries, and Turkey become sixth position worldwide in the tourism destination. So the tourist who is coming to Turkey, of course, they need some healthcare services as well, and this help a lot to Turkish private sector to invest more and more and open their chain of hospitals in different cities and different region and touristic region as well. And this has been help a lot for developing and opening up and doing the reform in healthcare. Next slide, please. So the first visionary leader started with healthcare reforms is almost 100 years ago, like 98 years ago. So Mr. President Mustafa Kemal Atatürk, he started sending the young physician and young doctors to abroad to get higher degree and higher specialty educations. Next slide, please. And today, the last visionary leader, His Excellency Recep Tayyip Erdogan, last 17, 18 years, he started new vision and new reform and new revolution in healthcare. Because with his vision, he started investment on PPP, public-private partnership hospitals, which is very important in reform of healthcare in Turkey, because he start allocating the land, he start giving the guarantee of the patient to the private investor, and he motivate the private investor to invest city hospitals, which is very big hospitals and very big investments, like 22 city hospitals being built in last 5 years. So it was the vision of the Mr. President Recep Tayyip Erdogan. Next slide, please. Mr. Minister of Çavuşoğlu, he is the foreign minister. To complete your revolution and reform in healthcare, you need to open up your country to international visitors. That's why Mr. Çavuşoğlu made big steps and open up Turkey to many countries without visa, visa-free. Without visa, many countries can come to Turkey as healthcare treatment or as tourists. So he supported also, and he contributed a lot, opening up the country with free visa visit or with special visa for healthcare. He supported and contributed a lot for the reform of healthcare in Turkey. Next slide, please. So the online exhibition support also introduced by the Minister of Interior and Minister of Trade. Nowadays, due to the pandemic problems, we start doing our online exhibitions and promoting our healthcare services and healthcare industry, which is very important also, and very big support for continuous our reform of healthcare, that we can keep sustainable service and quality in healthcare. Next slide, please. So as a result of available capacity of Turkey, there are 2,000 private hospitals and clinics, bed capacity approximately 250,000. The private hospitals 37.7%, the university hospitals 14%, and state and PPP city hospitals like 48.1%. As you can see, the PPP hospitals take now the majority in bed hospitals, in bed capacity in the hospitals. So we have built also in 45 days in pandemic time 2,000 bed capacity of pandemic hospitals in Istanbul. Next slide, please. So the medical tourism insurance also play big role now in the reform. We introduced medical tourism insurance to the patients who are coming to Turkey. We ensure that if any complication happen during the surgery, then the insurance cover fully the complication, and again they cover all the flight and accommodation of the patients. Next slide, please. So as a result of all this reform, you can see that Turkey number one in ICU beds, sharing of 100,000 people population. And then after us, America, and after us, Germany, and some other countries coming following Turkey. So Turkey number one, having now as an investment of hospitals and enough bed capacity, including the ICU. Next slide, please. So these are the PPP hospitals, which is newly built, fully integrated hospitals, 5-6 blocks, and 1,500 or 2,500 bed capacities. Next slide, please. So you can see these hospitals again in Ankara, more than 1,500 capacity, 1,500 bed capacity. Also PPP hospitals lately be invested by the reform, healthcare reform visions of Mr. President. Next slide, please. And this is the latest hospital we opened, 2,700 beds, 1 million square meters, the largest and biggest hospitals under one roof in the world. So this is the result of healthcare reform happened in Turkey by the vision of Mr. President Erdogan. Next slide, please. So thank you very much for listening to me. And this is my short presentation. I'm in a traveling position. That's why sometimes I have some problems with the connection, but I will stay with you to keep for any questions in our panel discussion. Thank you.
Thank you, dear Emin. Of course, we know that you have important meeting, but thank you again that you find possibility to present your important knowledge and experience from Turkey side. I think it's very great results. I am sure that all participants will agree with me. Also, of course, I have questions for all panelists, but I would like to start with you to avoid some interruption in the next time.
Yeah.
Very important topic, which I already introduced, that before Reformation, Turkey was very similar to Ukraine current position when doctors receive payment from the pockets of patients, and it was some maybe fears for Reformation, and of course my question connect with this is what was the reaction of market players, I mean players of the healthcare market, in Turkey for launch of reformation. And what is their feeling now? What is current when the reformation practically finished?
Actually, in Turkey, the situation was similar to Ukraine. And as a result, the government made a reform, healthcare reform, stopped by collecting money, the doctors collecting money from the patient, and also stopped by the doctors can work as a second place from the hospitals. So nevertheless, today's doctors only can work in only one location, either in government hospital or either in private hospital or either in private clinics. Otherwise, they cannot serve, they cannot work in two places at the same time. This was one of the main reform, part of the reform being done by Turkish government actually.
Okay, but how do you think? What is the feeling of medical professionals now when reformation is practically finished? Are they feel themselves good after reformation, better than previous times or not?
No, actually, this new regulation, but it's take about 5-6 years to adaptation. Only the government has made slight change about this point that now only the university teachers, university professors can work in the university and can serve in the private hospital or in government hospitals. Now the situation better and everybody been adapted of this law and everybody now is happy working in one location or in one hospital or in one place actually.
Mhm. Do you have any difference between salaries in private hospitals or government hospitals for doctors or not? And it depends on the
Yes.
quantity of patients and some procedures or not.
Is actually in government hospitals, they pay quite good salaries to the professors and doctors. And also in the private, they can get good salaries, but mainly they get according to the patient number and according to the operation number, they get some bonus as well.
Mhm. It's very close to Ukrainian logo that payment will go after the patients because it connects the quantity of procedures and surgeries. And what do you think? How many years we need to adapt the reformation according to Turkey experience?
Well, it took actually our reform. It took almost 20 years. I mean, the beginning was started 20 years ago in 2001. Start the revolution and the reform, and it took almost 20 years doing the reform, doing the investment, changing the rules and regulation, adaptation. It take quite long time. It's not easy because healthcare one of the very sensitive sectors in the world actually.
Mhm. Can you describe, according to your opinion, the main advantage of reformation of healthcare system in Turkey, and what are the benefits for patient and what are the benefits for medical professionals?
Actually, before the doctors need to look after 100 patients a day, and the patient was waiting so long queue in the hospitals to get the treatment, and there was no appointment system. There was people need to go to wait in the hospital from morning at 5 o'clock in order to see the doctors, and doctors was very busy, and it was not enough time for consultation. The reform bring a lot of comfort, a lot of quality for the patient, a lot of good comfort and quality to the doctors. So today's patients are very happy. The citizens, Turkish citizens, are very happy. No waiting time, no problem. You get your appointment, you go on time, you get and you see your doctors, you meet your doctors, you get your consultation. You have enough time to talk to your doctors, and doctors will be not get tired from many patients waiting in the queue and many crowded area and etc. and etc. So there is no crowd now in the hospitals. That's why we are receiving more than 1 million international patients and serving them in our hospital, because we have enough capacity. We have good system, appointment system to serve Turkish citizens plus international citizens as well.
Yeah, I know about it because many times we, as Ukrainian Association of Medical Tourism, organized the farm tours of Ukrainian doctors and medical tourism providers to Turkish hospitals, and we were impressed how quality in healthcare facilities are in current times. And sometimes we found that Turkish hospitals are better than some Western European hospitals, according equipments, because very often
we invested latest technology actually.
Yeah, sometimes we can find the newest equipment that we can't find in Western European hospitals. It was connected with, for example, true beam technology. It was connected with, for example, robot Da Vinci technologies, where robot Da Vinci was employed in practically each big Turkish hospital, but a few of them was in some Western European countries. But according to my experience, it's also and always connect with money and foundation, and it's connect with economy. And what is your advice to Ukraine? How we need to improve the quality of our information system according money, and how many percents from GDP we must allocate for healthcare system?
Actually, Ukraine need to do a similar reform as Turkey done. The Mr. President Zelensky need to take a very strong decision and need to implement it in the ground. I mean, taking decision and not implement it in the ground, it doesn't help. You need to take the decision, parliamentary decision in your parliament, and then you need to implement it very strongly. So I think Mr. President has this ambition. I'm hearing his talk always that he is willing to do healthcare reform, and also Ministry of Health of Ukraine are doing some investigation how Turkey done Ppp Hospitals, how investment being created in Turkey, and they are also willing to duplicate and implement a similar system in Ukraine. So Ukraine need to start allocating free of charge lands to the international investors, and also introduce some incentives like tax incentives, like 10 years of tax incentives and etc. That in order that to attract international investor to come and invest in Ukraine, because Ukrainian tax level is very high, and really the international investors cannot be part of the cannot come and contribute and can invest in the system of Ukraine. So Mr. Zelensky, Mr. President, need to take decision about the tax incentives and some land incentives, and attract and invite the international investor to come and invest in Ukraine, that can be done healthcare reform in the country.
I think it's very smart advice from your side, dear Emin. And of course, if you talk about investment, it's always stimulate to development of each niche of business. And healthcare system is also in this trend. And of course, if you talk about innovations and new technology and new facilities, which must appear in Ukraine also, like PPP projects or national project.
Right.
I believe that we receive new investment funds from different countries, and of course, including Turkey, like our strategic partner, because Turkey and Ukraine has friendship, and of course, we have partnership for not only healthcare system, but different fields of economy. And I would like to say thank you very much, dear Emin. And
you're most welcome.
Yes,
wish you successful events. Thank you.
Yeah, thank you very much, and goodbye.